Hey there! Welcome to the Mom World. If you're here today, you're probably looking to understand more about abortion and how it can impact your uterine health. So let's keep it straight and simple. First, abortion is a legal and at times necessary medical procedure. But like any medical procedure, it does come with some risks, especially to your uterus. Knowing these risks really matters before you make any decisions. Let's start with uterine perforation. This is when a surgical instrument accidentally pokes through the wall of your uterus. It's rare, but if it happens, it can lead to heavy bleeding, infection, or even damage to nearby organs like your bladder or intestines. Sometimes, it needs extra surgery to fix, and in the worst cases, even a hysterectomy. The risk is higher if you've had previous uterine surgeries, or if the abortion is in the second trimester. Next, cervical lacerations. During the procedure, the cervix might tear. Minor tears usually heal on their own, but deeper ones can cause problems in future pregnancies, like preterm labor. Now, let's talk about Asherman syndrome. This happens when scar tissue forms inside your uterus, often after procedures like D and C. It can affect your periods, make it tough to get pregnant, or even lead to miscarriages. Placenta previa is another risk, where the placenta covers the cervix in later pregnancies. It's more likely if you've had abortions involving surgical instruments. This can cause heavy bleeding during delivery, and might mean you'll need a C-section. Sometimes, there's a slightly higher risk of ectopic pregnancy. That's when a pregnancy develops outside the uterus, usually in a fallopian tube. This can be very serious, so early detection is important. Hemorrhage or heavy bleeding is also possible, especially if the uterus doesn't contract properly or some tissue remains. In rare cases, it might even need surgery or a blood transfusion. And let's not forget infection. If the instruments aren't sterile or tissue is left behind, infection can set in. Symptoms could be fever, foul discharge, or pain. If ignored, it can turn into sepsis, which is life-threatening. Finally, the emotional side. It's normal to feel a mix of emotions. Some women feel relief, others might struggle with guilt, sadness, or anxiety. Counseling or talking to someone you trust can be really helpful. So remember, abortion is generally safe when done by professionals, but there are risks. Being informed helps you make better choices and know when to seek care. If you have more questions or want us to cover any topic in detail, let me know in the comments. Don't forget to like, share, and subscribe to the Mom World. Take care and stay informed.